Hello, my name is Amy Bondurant, and my paper was on obesity, chronic disease, and mortality in endometrial cancer survivors. Endometrial cancer is the cancer that starts in the inner lining of the uterus. It is the leading cause of gynecologic cancers in the United States, with over 65,000 women estimated to be diagnosed this year. Most often, this cancer is diagnosed at an early stage, so the 10-year survival is over 75%. There are therefore about 600,000 endometrial cancer survivors alive today. Over 40% of the United States population is now obese. Obesity is strongly correlated to endometrial cancer. In a meta-analysis of 30 prospective studies, it has shown that endometrial cancer has an overall relative risk of 1.54 for every 5 kilogram per meter squared increase in body mass index. As we know, cardiovascular disease is the leading cause of death in the United States. Not surprisingly, it is also the leading cause of death in endometrial cancer survivors overall, and each year beyond 5 years of survival. Metabolic syndrome, hypertension, high cholesterol have all been found to be associated with endometrial cancer survivors. Receiving a cancer diagnosis has been suggested to be a teachable moment, a time to be open to change. However, studies have found that cancer survivors have the same lifestyle behaviors as non-cancer patients. In endometrial cancer, this can be from ignorance of the risk factors they had that led to their cancer diagnosis, or not having fear of recurrence, since often the cancer is treated with little more than surgery. Also, often their providers do not discuss the number of other risk factors for chronic diseases that these patients have, including their weight. There have been some trials specifically in endometrial cancer survivors that have aimed to test feasibility in weight loss in these patients. The use of group sessions and individual education and counseling about nutrition, behavior modification, and exercise have been used. Physician, RD, psychologist, and physical therapists have been a part of the trial teams. Texting, telephone counseling, and even a mobile application has been tested. The largest weight loss was with a telephone intervention with an average 9.7 kilograms of weight loss. Unfortunately, only 20% of patients kept that weight off a year later. While some report worse survival if you are obese and diagnosed with cancer, others have not found the same result. There are no studies in endometrial cancer survivors that show that weight loss improves their mortality. But we know weight loss does improve their overall quality of life and will help decrease their risks for other chronic diseases linked to their obesity. The optimal way to lose weight and maintain the weight loss has not been found in endometrial cancer survivors. Perhaps a change in focus to quality of life and therefore decreasing chronic disease would lead to positive, long-lasting results. Endometrial cancer with long survivorship is an opportunity to improve lifestyle, quality of life, and chronic disease, and therefore mortality. Finding each person's why may be motivating for change and can help lead to sustainable lifestyle changes. Incorporating the whole family unit perhaps would lead to even greater success, but this will need to be looked at in future trials.